I can't tell you just how delighted I was when I first heard about the James Lind Alliance, that for the first time ever, mesothelioma victims are to be given a voice and give their views and experiences into what they feel will make a difference and benefit people with the disease, to help decide what they and the clinicians and health professionals who treat them and get to know each patient's specific needs feel will make a difference to their lives. My husband Mick was diagnosed with mesothelioma in 2000, having been exposed to deadly asbestos fibres during his time spent in the Royal Navy. At the time, he was offered no treatment, support or information. We were told simply to leave and spend quality time together. Mick lived for 7 very precious months, and I went on to set the Mick Knighton Mesothelioma Research Fund up in 2002 in his memory. The fund is run entirely voluntary and has gone on to raise well over £1 million. The vast majority of this has been given by those who have the disease and the families who look after them. This is not money raised from wealthy people, it's money raised from ordinary people who give willingly as they know firsthand the desperate need for increased treatment options, symptom control, pain relief and awareness. As we all know, currently in the UK, 2,500 people are diagnosed with mesothelioma each year, as there is an extreme use of asbestos in this country and now has the highest incidence of the disease in the world. Numbers are rising at an alarming rate, and sadly no one, from whatever walk of life they may come from, is immune from its tragic legacy. Therefore, an initiative such as the James Lind Alliance is of such great significance. I've spoken with a number of people affected by mesothelioma about this UK-wide project, and they are equally as excited as I am and delighted their views and experiences may help set priorities for future research across the country. They hope for studies into earlier recognition of the disease and for GPs to become more asbestos aware, not blinkered in the belief that this disease is exclusive to shipyard workers and the like, and why one person working in the same location at the same time doesn't go on to have mesothelioma while others do. Improving public awareness of the connection between asbestos and mesothelioma may help lead doctors to an earlier diagnosis by providing them with the relevant history of exposure. Others commented on research into whether drugs taken years for other conditions hasn't somehow stabilised their condition. Mesothelioma is a particularly challenging cancer for both sufferer and health professional alike, with many unanswered questions. Therefore, the proposed survey will be most welcome, giving everyone who ever had questions about the treatment and care currently available an opportunity to raise their concerns that may, in time, make such a difference to those with the disease. I hope those with mesothelioma, brought about most often by doing no more than an honest day's work, having to endure the most debilitating of symptoms such as pain, breathlessness, sweats and fatigue, will have in their lives, however short they currently may be, greatly improved by the results of the James Lind Alliance's top 10 research priorities, chosen by the people who currently have to go through the pain and suffering a mesothelioma diagnosis can bring to both the sufferer and their family. Asbestos is a danger to everyone, as it is in our schools, places of work and even in our homes. The final top 10 research priorities, as determined by the James Lind Alliance Mesothelioma Partnership, will go a long way in helping to take care of the next generation, and that in the not too distant future, research will assist in finding improved treatments to provide a better future for people who develop this devastating cancer.